Hello and welcome everyone to one of our first webinars for owners. And today we're going to be talking about how to create a fit, resilient dachshund and reduce the risk of spinal disease. And so my name is Jerry and I'm going to be your MC for this evening. I'm going to be presenting Dr. Naomi Boyd tonight, and I thank you for tuning in. So I'm just going to take you guys through a quick introduction of what SASH is if you're not familiar with what we do. So we are a almost national hospital network here in Australia, and at the moment we've got 8 hospitals in total across Australia. Our first hospital started off in North Ryde here, as you can see on my screen. This is the single largest veterinary hospital in the entire Southern Hemisphere. Very interesting facility if you ever get a chance to visit us. But at the same time, we've got SASH Central Coast in Tuggerah, SASH Northern Beaches in Balgowlah, Alexandria, Western Sydney Prospect. And for those of you tuning in from Queensland, we have the Sunshine Coast in Sippy Downs. Try saying SASH Sunshine Coast 3 times, that'll be interesting. We've got Gold Coast in Robina and Adelaide Kent Town. So as a network, we provide a very broad range of services, a total of about 17 specialist disciplines. For a lot of you guys, you might be familiar with our 24/7 emergency and critical care service, which is open 365 days a year, 24/7, for whenever you need urgent vet care. In addition to that, we offer internal medicine, so those are the experts in diagnosis. We've got surgery, we've got oncology, which is about the treatment of cancer. We've got neurology and neurosurgery for the brain, dermatology for the skin, ophthalmology for the eyes, cardiology for the heart, of course, sports medicine rehab, which I'll explain to you a little bit more about tonight, avian exotics for companion animals other than cats and dogs, anything other than cats and dogs, dentistry, reproduction, behavior, radiology, which is all about diagnostic imaging, anesthesia and pathology. And those last 3 departments are very special to us because they're quite rare in the veterinary industry, and we're very fortunate to have these guys on board to support all of our other departments and the great service that we provide. So a little bit about sports medicine and rehab. This is a really interesting department that actually not a lot of people know about, and even among other veterinarians, a lot of people don't know what sports medicine and rehab is all about. So hopefully after tonight, you have a greater appreciation of something that's pretty cutting edge in the veterinary industry. And really what sports medicine does is it helps all dogs move freely, play, and participate in sports. And essentially, it's helping dogs to be dogs. The team here are experts in the investigation and also providing non-surgical treatment options for causes of lameness. And so we're talking about sprains, strains, injuries, or any form of abnormal movement. So here we're talking about a lot of you might be familiar with the term rehab, and you might think about something like this that comes to mind. So rehab being recovery from injury or recovery from surgery, and in the human world, this is an absolute critical part following surgery. You can't imagine anyone going home from, for example, spinal surgery without some form of rehab. But in the veterinary industry, this is still a very new industry, very new field for us. But outside of things like physiotherapy, massage, exercise, etc., sports medicine goes a lot deeper than that. And so there are more advanced types of procedures now available for people like yourselves and, of course, your pets. A couple of examples include hydrotherapy. And here we're talking about things like underwater treadmills. This is a great form of exercise that can help with rehabilitation, recovery from surgery, but also to prevent injuries and improve surgical outcomes as well. So there have been studies that have looked at hydrotherapy, and the results have found about 650% increase in things like limb circumference, 170% increase in range of motion following surgery, which is all great for surgical outcomes. Techniques such as PRP or platelet-rich plasma. And so this is a procedure which involves taking blood from a patient, concentrating down the platelets, injecting it back into the patient in an area that is injured or painful. And that helps to decrease incidence of lameness and improve pain scores as well, which is very positive. Another example would be laser therapy, and when used, it has been shown to decrease reliance on pain medication by as much as 50%. And so all very positive outcomes for technologies that are now available in the vet world. At SASH, people like Dr. Naomi offer what is called a lameness clinic. And so here, it's for patients with abnormal gait. The objective here would be to explore treatment without surgery. And a consult includes a thorough musculoskeletal exam, followed by gait analysis and a discussion around the broad treatment options, such as those that you saw in the slide previous. So the Lameness Clinic, it's available at SASH North Ryde, Alexandria, Western Sydney, and the Central Coast. If you're interested, feel free to get in contact with us at sashvets.com, or you could simply just Google SASH Vets. You could also fill in a survey at the end of this webinar. We'll be able to get in contact with you at a one-on-one level. So a little bit about our speaker. Dr. Naomi, she graduated from the University of Sydney first with a degree in physiotherapy, and then later went back to uni to get a degree in veterinary science. She started off practicing as a human physio, but then moved into veterinary medicine. And during her time as a vet, she trained quite hard to become a veterinary specialist in sports medicine and rehab. Now, that makes her Australia's only dual qualified sports medicine specialist who's also a physiotherapist. And so we are very lucky to have Naomi here in SASH, and she's probably one of the few people that I can think of in SASH who has had the pleasure of giving advice to my family, both the four-legged kind and the two-legged kind. And she is available at both SASH North Ryde and Central Coast. And so without further ado, I'm going to stop sharing and throw over to Naomi.
Thanks, Jerry. And I just want to point out that I'm very happy to see everyone's four-legged creatures, but no owner complaints anymore. No owner injuries these days. So I'm just going to share my PowerPoint. And so welcome, everyone. It is great to see so much interest in the topic tonight. This is one of the first times that we've done a webinar more directed towards our owners and people out there in the wider general public and owners of dogs. And we've had a really good interest. And I think it's really lovely to see that Dachshund owners, I think as we maybe all know, are a very dedicated bunch of people really keen to do the best thing that they can for their dog. And so, of course, the topic tonight, as Jerry said, was how to create a fit and resilient dachshund and to decrease their risk of intervertebral disc disease. Because we all love our duckies. They are big dog personalities in small dog bodies. They're out there to be running, jumping, getting into everyone's business. But unfortunately, they do come with this significant risk of intervertebral disc disease and the consequences that that can entail. And so before we jump into the how, what, why of reducing that risk, I wanted to get a read on what the audience thinks are the chances that their dachshund might have an intervertebral disc extrusion or a slipped disc in the future. And so Jerry is going to put up a poll for this. I'd really love if we get as many answers as possible to get a sense of what people think. With this poll, so the answer, the question is, what is the lifetime risk of intervertebral disc disease? Our options are a 1 in 5 risk, B, a 1 in 20 risk, C, a 1 in 100, and D, 1 in 2,150. And so I'll give everyone a little bit of time to get their answers in.
Good to see the votes coming in, Naomi. Looks like we've got a pretty strong consensus leaning towards one of the answers already.
Oh, excellent.
Okay, I might just end it in 5, 4, 3, 2, 1. Okay, sharing results. How did we do?
Oh, so this is fantastic. So this demonstrates that we've got a really educated audience online because somewhat unfortunately, perhaps, The lifetime risk of intervertebral disc extrusion for our Dachshunds is 1 in 5, which is really significant, right? That means that if you have another Dachie at home and you meet 3 Dachshund friends at the dog park, one of them is likely to have this in their lifetime. And there are multiple breeds out there that are considered to be chondrodystrophic, like Dachshunds, dogs like French Bulldogs, Beagles, even English Saffies. But among those breeds, Dachshunds have the highest prevalence of any of them. They also tend to present with this disease earlier in life. And when we even look at MRI studies of young Dachshunds at the age of about 2 years old, only 2% of those intervertebral discs are normal based on MRI grading. And furthermore, we see these degenerative changes appearing in the disc as early as 1 year of age. But of course, the reason why we care about this is not so much just that it happens, it's the consequence. And so that can range from at its most mild to pain. But pain can still be really, really significant, right? This can be a quality of life issue. And these dogs, the pain is significant enough that they are sad. I think everyone is quite familiar with the fact that this can cause a partial or a complete paralysis, and to treat that can involve fairly significant surgery and usually an extensive rehab process as well. And then, of course, the maybe less recognized consequence of a disc extrusion is incontinence. And dogs might be a little bit less bothered by this, but definitely it makes owners' lives really hard, and can lead to difficulties managing these dogs. And so if there's anything that we can do to reduce the risk of this happening, I think it's really critical that we try and implement that. Because prevention is always going to be better than having to cure or fix something. It is important at this point, though, that I do really highlight that what we're talking about is minimizing risk, not eliminating it. There's things that we can do to reduce that, but unfortunately, Dachshunds continue to have that genetic risk, and we can't control the degenerative changes that happen in the disc itself. We can more talk about the things that mitigate the impact on that disc. The silver lining, though, is that what we are going to be talking about tonight are things that are easily accessible to everyone. It doesn't require a lot of time. It doesn't require access to special equipment. It doesn't require a lot of money. And really what we're going to be talking about is how we set up lifestyles to be as protective and beneficial for our dogs as possible. And so again, to get a little bit of a read on the audience and what our understanding is of lifestyle and risk, we're going to have another poll, which Jerry will pop up. And the question this time is, if you were trying to reduce your Dachshund's risk of intervertebral disc disease, what should you do? A, walk them daily for at least an hour. B, avoid stairs and jumping off the furniture. C, allow playing and running only in the house or a secure backyard. Always use a lead outside your property. Or D, both B and C. Jerry, I'll leave it up to you to watch the answers rolling in and flick it over when you're ready.
This is a close one, Naomi. I'm going to give it another couple of seconds. I can see there are 2 that are jostling for first place.
Oh, interesting.
I might give it 5, 4, 3, 2, 1, and showing results.
Very interesting. Excellent. So this is probably more what I expected from answers. One of the most common questions that I get from owners is, what is it that I have done that has caused my intervertebral disc injury in my dog? And almost always the things that they are worrying about are not the things that they should be worrying about. Because the answer to this question is A. To reduce your Dachshund's risk of intervertebral disc disease, you should be walking them daily or exercising them daily for at least an hour. And we have 2 really nice, quite large studies looking at this. One was Dachshund specific, only included Dackies in it. And these dogs had their intervertebral disc disease confirmed by vets when they occurred. And it showed that dogs that were walked or exercised for at least an hour had a reduced risk of intervertebral disc disease. Only last year, this idea was confirmed in a study of 43,000 dogs. Admittedly, this was not 43,000 Dachshunds, it was a range of breeds, but I think it's an excellent proof of concept, which similarly showed that dogs that were walked or exercised for an hour or longer per day had a reduced risk of intervertebral disc disease. And since that was not the most popular answer, I think it really speaks to the way that we need to perhaps change our perspective on how we prevent injury and set our dogs up to be prepared for the activities of daily life rather than trying to protect them. Because dogs will do things like this. Hopefully your Dachshund won't quite do things like this, but even the most conscientious and diligent owner can't stop their dogs from all running, jumping, or playing. It's going to happen in real life. And the other point to that is, to be honest, we don't want to. A dog who is that restricted from the things that they love is not having the kind of life that the dog really wants. We all know our Dachshunds, and I think probably 80% of our Dachshunds' favorite things to do is leap off the couch, fang it around the corner of the lounge room door, run up to the front door and bark. And we want to enable them to do those things that they love to do, maybe not the barking. So our goal here is to set our dogs up to be able to cope with those activities. And what that means is creating the fittest, strongest, most athletic little dog that we can, so that when they do these things, they're better prepared for them. So no back braces, but instead, let's turn them into little athletes. And so, as we said, for dogs, movement is life. They don't read books, they don't watch Netflix, they don't have deep and meaningful conversations. Being able to run, jump, and play is critical. And movement itself, as we talked about with the walks, is protective. And then the second part to it is that we want to include activities regularly that we expect our dogs to do. So if they want to be able to play with another dog, they need to be able to change direction quickly. If they're going to get on and off the couch, we want to know that they can do that well. And we want to include these activities on a regular and ideally daily basis. Those two studies that I mentioned earlier with really big numbers of dogs in them, the first one that was Dachshund specific showed that dogs that were allowed to jump on and off furniture had a reduced risk of intervertebral disc disease. The second study, the one with 43,000 dogs, showed that staircase use was associated with a decreased risk of injury. And this, I think, makes sense when we think about it in an athlete context. So what I often discuss with our owners is if you had two athletes, both soccer players, had competition matches every weekend, one of them goes to training every week. She goes to the gym, she does some strength work, she's generally fit and active before she turns up on a Saturday to play her game. The other one, really busy, never makes training, has no peripheral or extra strength work, also turns up for her soccer game because she loves to play. Those two players both go in for a tackle, and we both know intuitively that it's the one that's not going to training that's more likely to pop their knee or to tear their hamstring. And the same thing happens with our dogs. The way muscles, tendons, and ligaments are all there to transmit the forces from the ground and limbs into the spine. And the fitter and stronger and better active that they are, the more quickly that they can respond, the better able they are to control those forces. We can't change what's happening at the disc, but we can change the things on the outside. Apart from keeping your dogs moving and keeping them doing the activities that we know they're going to encounter regularly, If we want to go a little bit further, even better, let's build them up. Let's target the activities and the muscles that they're going to need in their day-to-day life. And so whenever I watch a lecture or I engage in a little bit of education, I really like to come away with some practical takeaways. We're going to run through a couple of exercises designed to target these muscles that are most important. I have little Ollie here who agreed to be my superstar, and he was very, very food motivated. I have him set up here, and all we're doing is a 3-leg balance. So I'm lifting each of his feet. I'm trying not to support his body weight as I lift them up. Less so in the front. Duckies have quite small legs. It's hard to get a hold sometimes, but you can see I'm trying to just hold on to the toes. And I'm allowing him to balance. And you can see that trunk movement. You can occasionally see his tail kind of move side to side to help with that balance. And I'm letting him sort that out. That same ability to balance well on 3 legs is important when you're trotting, when you're walking, when you're changing direction, or when you're unexpectedly T-boned by another dachshund. The next exercise we have here is something I call a side crunch. And I call it a side crunch because often people think this is about stretching. It's about opening up the side that's most stretched. But really what I care about as we bring this nose right around to the tail is switching on our abs and switching on the muscles next to the spine to get that crunch and get them activating and building some strength. Really easy exercise. The nice thing here for dogs, of course, is these are treat motivated, and you know that they are going to work as hard as they think the treat is valuable, which is usually pretty high. Final exercise is something that I call puppy push-ups because that's what it looks like. And probably if you only had time to add one thing into your routine, this would be the exercise that I choose. And so I've given it a fancy name, but if we're very honest, all we're doing here is moving between a drop position, which is not very far down if you're a dachshund, and then coming up into a stand. For Ollie, he's doing really nicely. I've set him up on a foam wedge so that I'm increasing the amount of drive he has to have from his hind limbs and making him work a little bit harder. Obviously at home, if you have the slope of the driveway, if you've got a hill in your backyard, you don't need a foam wedge, but you can do the same to get that drive from behind. It is important to point out that the things that we are talking about are for fit, healthy dachshunds without a previous injury and that are not in signs of pain. So I'm conscious that there might be some people out there who have a dachshund who've seen this and have signed in because they're a little bit worried about them. Maybe they've been a little bit off. Maybe they're not always comfortable being patted. Maybe they're just not walking quite right or something is going on. If that's the case, please get them checked out, whether you're coming into SASH or going to see your usual vet. What we're talking about today is definitely prevention, not treatment. The other big lifestyle factor to talk about for our dachshunds is, of course, nutrition. And we have multiple studies showing now that if you're a dachie who's a little bit overweight, it does increase your risk of intervertebral disc disease. Weight loss, interestingly, can be just as hard in dogs as it is in people. If you look at the studies, the success rates can be amazingly similar, considering that dogs don't have to walk past the lolly aisle on the way to the checkout. But really, really important thing to do, and can have a huge lifetime benefit, not just for intervertebral disc disease, but also for their general health and their joints. And so we've got these 3 dackies across the screen. I think everyone is fairly happy that the dachshund on the right is probably a little bit more rotund than they should be. We can't really see a tummy tuck there. We're a bit more loaf-shaped than dachshund-shaped. I think there's many people, though, out in the community that would think the dachshund in the middle would be fairly lean. And look, I feel a bit mean saying that this dog is overweight, but what I would really like to see is the dachshund on the left. So sometimes I think because they are small dogs, we forget that these are dogs bred for hunting. These are bred for work. They've got big, deep chests. They're designed to have a nice tummy tuck. And so you can see the line from their rib cage coming up towards their back. And then these lovely hind limb muscles, along with the muscles through the front legs. I would say that maybe more than half of the dogs out in the community, or dachshunds in the community, fall into the middle category. And I would love to see if we can shift more of them over to the left. The other question that I get asked is, well, generally I don't get asked how much should I be feeding my dog, but I get asked what I can feed my dog to help them. And that really large scale study that we talked about before actually showed that dogs that were fed a commercial diet had reduced odds of intervertebral disc disease than dogs that were fed a home prepared diet. And so I think diet is an area where people get really passionate, and there might be a lot of people that react to that statement. But what I would take away from it is not necessarily the commercial descriptor, but just as in people, these guys will benefit from a complete and nutritionally balanced food. If you are someone who really loves home cooking for your dog or home preparing food, there are some great resources out there for balanced diets. In particular, I like the Veterinary Nutrition Group's list of diets that they have available. And making sure that they're getting a good balance of everything they need is obviously critical. I'm sure there's many people who would love for me to give a list of supplements. It's always nice to have something very simple to do. Unfortunately, the answer is never that easy. And in fact, one study showed that the supplementation of dachshunds with glucosamine and chondroitin actually increased their risk of intervertebral disc disease. Apart from that single study showing that it would have a negative impact, we have no good evidence for the use of other supplements in this area. And so I would really stress that for this group of dogs and for this disease, the answers that we want to focus on are the simple but really important things of creating a fit, resilient, athletic dog that's being fed a good diet that meets all their nutritional needs. So I wanted to end on a slide with a photo of there's so many of the dachshunds that I've worked with over the years. They are an absolutely stellar bunch of dogs, and it's a stellar breed. And I'm hopeful that I've given you a few tips and clues that might change the way that you're doing things. Hopefully, as silly as it sounds, I would love it if that means that we never have to see you here at SASH, though of course we're always here. Thank you everyone for listening.
So again, thank you for tuning in on a Wednesday night. Really appreciate it. If you guys enjoy content like this, we can certainly do more of it, whether it is Dachshund specific or other breeds or other conditions. I'm very excited to help educate the population out there of dog owners. So thank you again. Thank you, Naomi.
Thanks, everyone.
Hey, have a good night. Bye.